Well, we can talk now to Dr. Faye Kirkland. She's a GP who's worked in Bristol and has recently been reporting on waiting times in A&E for BBC Radio 5 Live. So, Faye, welcome. Just a few weeks ago, we were telling our viewers that Southmead was doing really well, and now today they're nearly the worst in the country. So what's the problem here from your point of view? Is Southmead just not big enough for the area it's supposed to serve?
I think it's a complex problem, but when you look at the number of people who are attending A&E, as Andrew said, is up year on year. But when you look at the number of people who are attending Southmead, it's actually much higher than the national average. So in February this year compared to February last year, there was a 1% increase in people attending A&E on average. But at Southmead Hospital, that was up by nearly 7%.
And how can we account for that? What might have happened?
I think that is a difficult thing to account for, but I think one of the problems is probably people accessing their GP. We know that people are finding it more and more difficult to get a GP appointment, but I don't think that's just a problem at Southmead. I think Southmead's having a problem getting people in from A&E to be admitted to the hospital, and that's because they have a problem discharging people from the hospital into the community. So we know that there are a number of people, there are lots of people who could be discharged, and those people in A&E could then take their beds, but according to the Care Quality Commission, 20% of people in October and November last year had to wait more than 4 hours, so they waited an extra 4 to 12 hours after they were seen just to get a bed in the hospital if they needed to be admitted.
Now, A&E departments all across the country are missing these targets. Does this mean that the targets themselves are impossible to meet?
No, I spoke to the Royal College of Emergency Medicine. Those targets are there for a reason. They're there to protect patients. In fact, the target used to be 98% and was downgraded to 95% because not everyone needs to be seen within 4 hours. It is appropriate sometimes for patients to spend more than 4 hours in A&E, but the sheer problem is the demand, the number of patients. So 1,200,000 patients attended A&E in February alone this year.
Faye Kirkland, thank you so much for your time.
On Twitter, we're at BBC 5 Live. Our reporter, Dr. Faye Kirkland, is a qualified GP. Morning to you, Faye.
Morning.
Faye, this is new information showing how A&E departments in England have been coping with demand.
Yes, we put a Freedom of Information request to all English trusts with major A&Es asking how many patients were still in the department 12 hours after arriving. Now, this information isn't currently published in England, although it is available in Scotland, Wales and Northern Ireland. And I started looking into this after being contacted by a concerned A&E staff member, worried that the lack of published data about 12-hour waits in England is hiding a significant problem.
We've been speaking to one GP who's been working in A&E over the past few weeks.
So over the last few weeks in A&E, I've seen people with minor injuries such as sprains or common colds, and I think people are coming because they're generally worried and they're not really sure where they should be going, and I don't think the message for those patients is necessarily clear. I think a lot of those people could have seen their GP or gone to minor injuries units or to the pharmacy.
Now, the NHS would often prefer people to visit a pharmacist in the first instance, but it seems not enough of us do so.
We know that something like 50 million UK GP appointments each year could be saved by people going to the pharmacy. We know that pharmacists are really experienced healthcare professionals who give a really good advice about a whole range of common conditions such as colds, flus, sore throats, and they can give medication which you can buy over the counter.
A little earlier, I spoke to Dr. Faye Kirkland, who's a GP and a medical journalist. I began by asking her what the current guidelines are for treating a child under 1.
So currently there's no absolute guidelines that say doctors or nurses have to see a child under 1 on the same day, but there are very clear guidelines which have been around for more than 2 years, which ask doctors to look at all children under 5 with a fever and triage them, and those guidelines are from the National Institute of Clinical Health and Care Excellence. And what they're really doing is to try and identify those sick children, so those are high risk of having immediate life-threatening infection or illness that needs to go to hospital, those who are intermediate risks who need to see the GP or the nurse on the same day, and those who are low risk where it might be appropriate just to give telephone advice.
Now, the CQC found no problems with the clinical practice, but do you think improvements could be made to the system?
I think it's very important that if you are doing telephone triage that people have the appropriate training, and that I think people often kind of do extra courses to make sure that they have got the ability to do that appropriately. It's also really important that it's documented thoroughly so that you are asking parents about the child, how they are, particularly their activity levels, their their respiratory rate and make sure that's documented. And if you're deciding that you're not bringing someone in, then you need to make sure that it's clearly, appropriately documented, that when a parent should call back so they know what the worrying signs are and when they should go to the GP, the out-of-hours doctors and A&E.
On DAB Digital Radio, digital TV, downloads and online.
This is BBC Radio 5 Live.
5 Live investigates with Adrian Goldberg.
Now, how a 5 Live investigation has sparked questions in the Houses of Parliament. It's all about the delicate subject of sexually transmitted infections. A few weeks ago, we told you how embarrassed patients who fear they have gonorrhea were turning to the internet for a cure. But we exposed several online pharmacies who weren't offering the best recommended treatment. That leaves individuals and the wider community at risk. One of the online sites we looked at was run by Health Express, and they featured TV doctor Hilary Jones in a video. Now, Faye Kirkland, who is a GP, uncovered the story for us. And Faye, the treatment being offered by all of the online pharmacies that we discussed last time isn't the best recommended way to tackle the disease.
That's right, and Health Express has now taken down the Dr. Jones video. They and the other online pharmacies we featured prescribed antibiotics, which they then sent by post. But the best treatment practice guidelines say that you should have an injection alongside tablets, which you can only get at a clinic or a GP surgery.
Yeah, and we heard the clip earlier from Dr. Hilary Jones. What's he saying?
Well, he told us that he would have loved to appear on the programme, but his schedule wouldn't allow it.
Oh, shame.
He told us in a statement that as soon as we brought this to his attention, he told Health Express that the information on the treatment of gonorrhea was out of date. He also said that a combination of 2 different antibiotics is still widely used if the injection is not available or declined by the patient.
And he also praised 5 Live Investigates.
Yes, he said, and I quote, "It does your programme credit to use investigative journalism constructively whenever it's in the patient's best interest."
Thank you, Dr. Hilary. Thank you, Dr. Faye, as well. Thank you, Faye Kirkland, with an update on how one of our investigations sparked questions in the comments. So that's the Shadow Health Secretary, Labour's Heidi Alexander. Faye, what have NHS England and the Department of Health had to say about our findings?
Well, NHS England say they are transparent in the way they publish their figures. The Department of Health says the NHS is busy but performing well, and that the overwhelming majority of patients are treated or admitted to hospital quickly, with more people being seen every day within the 4-hour A&E target than 5 years ago. And they've invested £10 billion to fund the NHS's own plan for the future.
Faye, for now, thank you. Our story was based on a freedom of information request and covered about half the NHS trusts in England. Well, now, following our report, all the figures have been made public for the first time. No one else has seen them, and they show that in the last 3 years, more than 250,000 patients spent 12 hours or more in casualty. And it means for the first time, we can now broadly compare how quickly patients are being treated across the different nations of the UK. Our reporter, Dr. Faye Kirkland, who is a GP, uncovered the story and will tell us more shortly. Dr. Faye Kirkland then. Faye, after we covered this story, there was a very interesting development.
Yes, a source contacted the programme and leaked us information which they said was the full picture about patients spending 12 hours or more in A&E. Although this information is made available in Scotland, Wales and Northern Ireland, NHS England doesn't routinely publish figures for how many patients are still in A&E 12 hours after arriving.
In an investigation for this programme, we've discovered that some organisations which operate care around the clock aren't stocking vital drugs because of strict government regulations. So the relatives of dying patients who want their care at home can end up having to drive for miles to find a chemist that's open and can help them. Dr. Faye Kirkland is a GP and brings us this exclusive report.
This is now our dining room again, but for the last 2 weeks of my wife Wendy's life, this was the mini high dependency unit.
Peter's wife died from a brain tumour. In the final hours of Wendy's life, her family had to drive to a pharmacy because the out-of-hours doctor didn't have access to vital drugs.
When the GP finally came out, he handed us this prescription for diamorphine and insulin. I just couldn't believe what I was seeing. And I said, what do we do with this prescription? And he said, well, you have to go to a pharmacy and get it filled.
Now, remember our undercover investigation a couple of weeks ago into vitamin and mineral infusions? They're the latest celebrity health fad. They cure stress and depression. They reduce blood pressure. They treat hepatitis. Well, following our report, the medicines regulator, the MHRA, has launched an investigation into 21 clinics offering the treatment. Let's hear more now from the reporter Faye Kirkland, who looked at this, and she's a GP herself. And Faye, I think, if I remember rightly, what surprised you most was the whole lack of regulation around these infusions.
Yes, despite the vitamins and minerals being given intravenously, so straight into the bloodstream, they're not automatically classified as medicines by the MHRA. Vitamins and minerals are typically seen as borderline products, so they fall between a medicine and a nutritional substance. That means any advertising mustn't make any claims that they act like a medicine.